they're clearly conducting business illegally all day, every day. That's because the illegal return on investment is higher than the legal return on investment.
It seems that there's been a lot more sympathy for the alleged shooter and a lot more outrage at United Healthcare.
When you have a 30% claim denial, that is upsetting everybody. If you're making United and its stock shareholders rich.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, it's Jordan. Delighted to be joined by Dr. Bill Hennessy. I'm really excited to have you in the recent months. Obviously, the topic of the healthcare industry and, in my view, the predatory nature of a lot of our health insurance industry has come into the spotlight. And you've been inside and outside and have a lot of battle scars to tell. So first, tell folks, because you kind of describe yourself as the insider's insider, tell people your background, how you got started in healthcare as a doctor, and then how you kind of evolved to the outside.
Well, I'm a private practice MD as a young physician. Knew I wasn't collecting the money that I should have been for the amount of care I provided patients. I suspected billing shenanigans. Took a couple years, and then I did start doing my billing, and I was right. And follow the money, as they say. And then that caused me to start a physician billing company to help other private practice physicians. This honed my skills on medical billing codes. I was able to practice conquering the four-word definition of a health insurance company, which is collect premium, deny payment. By 2014, I just kept getting asked, I can't afford my deductible. It's now $5,000 or $10,000, and I can't afford my premium, which is $600 or $800 a month. What do I do? And I kept hearing that, and eventually I created a price transparency company and developed a half dozen techniques to have know before you go pricing. Then I realized nobody wants to do this. Nobody wants to battle a hospital bill. So we expanded, and I co-founded Care Guide Advocates, where now we have the team, the tools, and the training that results in service and savings. So we do everything for you to lower your healthcare costs before, after care. Background, I also am the son of a C-suite hospital executive, board of director member for 55 years. So even though that's dad, I say, I know how hospital executives think and behave, and we use it against them to get you a lower price tag.
And, you know, it's interesting because it sounds like when you were practicing, you kind of just realized that the insurance companies, for lack of a better phrase, were scamming you out of money that you should be getting. Can you kind of talk about how did you figure that out? I guess you had to do a lot of research on your own.
Yeah, there's this thing called denials. There's so many claim denials. It was the key headline associated with the United Healthcare CEO assassination. Across the board, Blue Shield, United, Cigna, and Aetna deny an average of 20% of claims. So their working America is, and 1 out of 5 of you have been busting your butt to pay a United $30,000 for a family of 4 and a $6,000 deductible. So you got $36,000 you're paying before they pay for $1 care. And they have the nerve, if you're one of those people, they deny 30% of the time. And I'm gonna make it crystal clear. They deny claims based on price tag. It has nothing to do with the care. It's, wow, that's a $20,000 care. We're gonna deny it. But wait a second, Dr. Hennessy's in network. I'm an in-network United provider. That means I am so good, they should just trust me with the care I prescribe, right? At face value, yes, but it all comes down to POP. They want POP, profit over patients. So if the price tag's high, it needs pre-authorization, and then they deny. If the price tag is low, only in the hundreds of dollars, doctors can prescribe that, and that can occur all day and get paid for. The other thing is the billing. The other key, one key, billing coding. There used to be about 12,000 or 13,000 diagnosis codes. 10 years ago, that expanded to unnecessarily to about 73,000 codes.
Jesus.
There's no need. Now with that, you have to put a diagnosis code and a billing code together to get paid. But when you have that many diagnosis codes, it permitted the carriers, the insurance companies' software to have more mismatches to create more denials. So the key is, if you're a doctor, you need to see all your denials to understand what magic code matches get you paid compared to which ones get you denied. People's lives are at stake, but they call it a game.
It sounds to me like the insurance companies have created this very complicated Byzantine system to exhaust and frustrate doctors, exhaust and frustrate patients, to the point that either the doctor or the patient or both will just give up and either accept the denial or pay out of pocket.
100% accurate. Millions of dollars have been spent on marketing to understand the patient. I said the word patient, not healthcare consumer, because the consumer makes informed consent, and that does not exist right now. If you're our client, it does, but for the most part, it doesn't exist. So frustrated and confused, those are the two words. They want us to be frustrated and confused until we just open up our wallets and hand over wrongfully everything that is illegal and unethical in those bills.
Can you talk about when you were a doctor? Obviously, there's real human stakes here. People die because of not getting care, misdiagnoses, if an MRI was denied, or there was a delay to get that mammogram. Talk about the real human consequences you've seen from patients for these denials.
Well, here's the truth. 2 out of 3 people delay or don't get care for fear of a surprise medical bill and predatory billing. So the majority of our country isn't getting the care it needs when it needs it. That is very costly because it can and does result in death in cases. And in other cases, if you delay fixing something when it's small, you got a much higher price tag to pay physically and financially at a later date. So it is an extremely costly issue.
Can you talk about? I've seen you talk in other interviews about hospitals kind of playing games known as like Charge Master game. Can you break that down for dummies?
Yeah, Charge Master. It's the retail rate. That's a big word for retail. So they have to publish their retail rates. Now, I haven't seen a hospital yet provide a full list of its retail rates. Now, if your claim is considered denied or out of network, or you don't have insurance, they want you to pay the retail rate. So let's say the claim was $100,000. Their game is they use the swear word called discount. We'll give you a 20% discount now if you pay in the next 30 days, or 50% discount. And that sounds, well, that's a big discount, right? It's now only $50,000. It isn't about the discount. It's about what the care is worth. And in letters, I've been known to put, dear person for the hospital, we're going to go ahead and we are going to sell you a John Deere 36-inch riding lawnmower. It's $1 million. I'm going to give it to you at a 90% discount for only $100,000, but you have to buy it by the end of the month. Mm-hmm. My teaching point is the heck with discounts. If that $100,000 bill's out there, but I know that the care is really only worth $10,000, the argument's going to be, if you want to get paid, you got to get us to the $10,000 price point.
And let me ask you, I mean, not to get too into politics, but Obamacare, Affordable Care Act was supposed to fix some of this, supposedly. It's called the Affordable Care Act, but premiums have been exploding in recent years. And this just seems like one predatory game of Monopoly where there's very little regulation, maybe civil penalties. The DOJ is currently investigating United Health civilly, not criminally. But these companies basically, am I missing something, or are they basically allowed to do whatever they want?
they're clearly conducting business illegally all day, every day. That's because the illegal return on investment is higher than the legal return on investment. And when they get busted for fraud, what you're not going to see published out there, but I'm going to tell you, without naming names, I'm going to tell you the common fine is 5 cents on the dollar. So if you commit $100 million of fraud and it only costs you $5 million, what does that encourage you to do? Brazenly figure out how many more other ways you can commit more fraud. Look at the drug industry now. The three largest drug pharmacy benefit management savings companies, by their name, that's a joke. Optum RX is owned by United. Express Scripts is owned by Cigna. And Caremark is owned by CVS, which owns Aetna. So the large self-insurance, health insurance companies, guess what? Their stock shareholders only make money if the cost of care goes up. So am I to believe, or are you to believe, that you can go ahead and just say that they're going to save money when you can't have a stronger financial misalignment? Therefore, the Department of Justice and the Federal Trade Commission have both sued. They have both sued the three big pharmacy benefit management companies for illegal drug price fixing. Now, Caremark, aka Aetna, is getting scared that they're going to have to pay. So they sued the drug manufacturers. Now you got finger pointing. We say, we want those crooks to pay more money than us crooks. So we're going to start finger pointing. So yes, the illegal ROI, return on investments, higher than the legal ROI, to again emphasize your point. And
just so happens a lot of these insurance companies happen to donate quite a lot of money to politicians. So there you go.
Well, in case you wondered, over $100 million per year is lobbied by health insurance and other insurance companies to the 500 politicians in DC. Doesn't matter which side of the aisle they're on, they buy them all off. And the American Hospital Association lobbies over $20 million a year. They get their way too.
Can you talk about, because your company, it's called Care Guide Advocates, you're not just advocating, you're kind of dealing with, all the predators coming from different angles. So you're advocating, you're dealing with hospitals, but you're also dealing with the pharmacy benefit managers, which are just completely, in my opinion, unnecessary middleman. You're dealing with the insurance companies. So you're kind of having to swat away 3, 4, 5 different entities to get your clients either approved or a discount.
Yes, we can tell you beforehand where to go and what to pay so you don't get a surprise bill. You never overpay for care because we know the price of care. And afterward, we have a program called Hospital Bill Eraser. In the event that you needed care and you just look at your bill and you say, I know I'm getting ripped off and can't afford that, but I don't know what to do about it. We just have 2 words, sign here, and we take care of it. So Care Guide at its core is a medical cost savings, price transparency, and advocacy company saving people money. At Care Guide, we're putting the care back into healthcare. We say, don't be bullied, be the bull. You hire Care Guide, we're going to take on the hospitals or insurance companies for you because we know what we are doing. And there's obstruction at every level.
I want to give one example here. Obviously, United Health has been in the news due to the CEO being assassinated. Right. But I mean, there's been great reporting recently. This is from the Wall Street Journal, how United Health has basically been scamming its patients, particularly seniors, on Medicare Advantage. I'll just read this part. Like most doctors, Nicholas Jones prefers to diagnose patients after examining them. But when he worked for United Health, the company frequently prepared him a checklist of potential diagnoses before he ever laid eyes on them. United Health only did that with the Eugene, Oregon family physician's Medicare Advantage recipients, and its software wouldn't let him move on to his next patient until he weighed in on each diagnosis. Long story short, they were basically accelerating, increasing the sickness score with basically unnecessary or just wrong diagnoses so that they'd get more of a payout from Medicare. Do you see this kind of thing happening with Medicare Advantage and elsewhere?
Absolutely. This is not a new story, by the way. I'm just going to give you what no one else will tell you. This has been going on for decades. So Hospitals could get paid, and carriers could get paid Medicare Advantage. So what happens is United has over 2/3 of its revenue from government contracts. So it doesn't care about Jordan or Dr. Bill. They're going to make their money by buying off the politicians and having contracts for health insurance for federal, state, and other government sectors. So they lobby in every state to get Medicare business. Now, the Centers for Medicaid and Medicare, CMS, they don't need to administer those claims. United goes in and says, we'll take over. You just got to pay us. And then they make more money for their shareholders. That's what's happening. Now, they want more money than the money that they're supposed to get. You get paid more if there's a higher severity score. So let's say that today Jordan has 3 active medical conditions, but in the past 10 years, you've also been admitted for 5 other ones. They want you to list 3 plus 5 or all 8 medical conditions to say, oh my God, Jordan is so sick. But meanwhile, 5 of those conditions are old and resolved. So they're not dating them, but they're adding them all in to create diagnosis codes that make the patient appear more sick than he or she is when the hospital admission is something simple and routine. It's for one reason, just to get paid more.
Couldn't that potentially risk the patient's health? Because if you're increasing the diagnosis scores, you're ascribing to them illnesses that might be, like you said, in the past, and therefore, wouldn't you potentially be overprescribing them?
That's not going to happen. What will happen, though, is you're going to decrease their access to care just because your insurance premiums are going to go up. So if United's goal is to make more money, they're going to have to figure out ways to charge you more money every year. And this is one of them.
Right. You know, from a broader picture, there's a lot of, I believe, propaganda out there about other countries' systems. I've seen a lot of doctors say we need a single payer system, whether it's Medicare for all or, something or a government option. Then others on the industry side say, well, if you want to do that, you could wait, a year for a knee replacement, or, basically saying that other countries with universal systems, you have to wait for care. But bottom line, this system is intentionally too complicated. Based on your inside and outside experience, what is the immediate way to simplify the system, get patients better care?
Well, we have a whole lot of tail wagging the dog. That means right now, stop and think about it. We have blended healthcare from health insurance. Those need to be separated again. Okay. So I see a very significant trend that I'm 100% certain is going to increase. Outpatient care will be cash price. Outpatient care is not insurance. Think of how stupid it is to present an insurance card to see a doctor. Blue Shield, United, Cigna, or Aetna will pay a doctor on average $175 for a new visit and $125 for a follow-up visit. That's not insurance. Insurance is for financial catastrophe, something that's tens of thousands to millions of dollars, not a $125 follow-up visit. So, but when you hide the cost of care between the hospital and the insurance company, they're figuring out ways to make more money behind the scenes. So, you go ahead and you pay a cash price for a GI scope and it's $1,600. You tell them you have Blue Shield and they start salivating because now they charge $6,000, give a discount of, a third, and they're paying $4,000 instead of $1,500. So your reward for having health insurance is you have to pay more. So if we get to a true cash price for everything outpatient, and it should be, and we pay for mammograms and strep throat tests and immunizations, $20, $30, so what? Now you have major medical. That's a term in the 1970s. What was insurance for then? Hospitalization and cancer care, expensive care, things that are physically and financially threatening to you. If we separate care from insurance, I think we could literally decrease health insurance premiums by 50%. So what's going to happen is we're going to have a cash pay outpatient. And then what we're going to do is have better hospital policies that cover only catastrophic. And Blue Shield, United Sigma, and Aetna have lobbied against that. But there's ways that right now, with momentum and strategy, it cannot be stopped.
And my last question, from a doctor's perspective, because we've seen doctors go viral in recent months talking about, spending just as much, if not more time on the phone with insurance companies than with their patients. Doesn't this create both risk of exodus of good doctors from the industry, but also if doctors are so stressed out or frustrated dealing with insurance companies, that obviously weakens patient care?
Yeah. So the bottom line there is you hit on important points. There has been no doubt in the recent past 6 to 10 years, more doctors have retired clinically earlier. I'm one of them. I've now founded 4 healthcare cost savings companies since. You retire earlier, there's a doctor shortage. By requiring doctors to use an electronic medical record, even a software savvy physician has slowed down 25%. That's created a 25% physician shortage and a whole bunch of bureaucracy. In fact, the electronic medical record, the only thing it accomplished is it's for profit over patients. It's to force doctors to use the hospital facilities, which is the most expensive place to get care. It's being used to control money flow. It hasn't decreased morbidity or mortality, disease or death. And the EMR is an evil tool for money making, period. We are seeing that exodus. I'm encouraging more physicians to do, for at least their outpatient office visits, it should be cash pay. The hell with dealing with the carriers. Your doctor visit's cheaper than your plumber or electrician. Just pay your doctor cash and say, thanks for caring about me and my life.
Tell people how they could find out more about your advocacy group, Care Guide Advocates.
We have a website, cgasaves.com. Care Guide Advocates Saves.com is what it stands for, cgasaves.com. They can learn more about what we do there. We are sold within a health bundles plural. That means we combine a bunch of care, unlimited and no out-of-pocket blood work, 1,500 generic drugs, our hospital bill negotiation and hospital bill eraser and price transparency services, telemedicine, all packaged for one small ballpark $50 to $70 a month fee, like healthfreedomus.com. Anybody can start signing up today. I can even provide you a link for your website. But people need to know that we and other key cost savings partners exist. And if you get away from hospitals, Blue Shield, United, Cigna, and Aetna very quickly for all of us, the price of care is much more affordable.
And sorry, one more question. Obviously, nobody's condoning, we're not saying go get your gun, shoot CEOs, but were you surprised at all by this outpouring of basically outrage by Americans? We've seen it on the left, the right, both sides. It seems that there's been a lot more sympathy for the alleged shooter and a lot more outrage at United Healthcare. Some of the polls show, particularly among young people might not condone the assassination, but at least understand the motivation behind it.
Nobody likes being ripped off, and everybody thinks they work hard for their money, and they do. So when you have a 30% claim denial, that is upsetting everybody. If you're making United and its stock shareholders rich, and this is such a vulnerable time, you're sick, your life is on the line, you've paid into this for this financial security, and they deny it, you can't make someone more irate than that, other than to highlight the fact that the guy had a $10 million a year salary. So he's sitting up there in his king's chair with his crown on and telling the minions that make 50 or 60,000 to just go away. We're going to deny your care, but you don't have our deep pockets to fight this, while he's being fed his grapes. That's the vision that's going on now. You can't make America angrier than it is right now.
And He was very instrumental in them deploying artificial intelligence to deny more claims. So,
as I said, the illegal return on investment is higher and they get away with it. So let's just keep doing it even more ways. And
absolutely.
What better way than AI to jack your revenue?
Thank you, Dr. Bill Hennessy with Care Guide Advocates. Really appreciate it. Let's stay in touch.
You're welcome.